and significant contributions to the field of physiotherapy. In addition to her clinical practice, Dr. Seema also serves as an advisory member to the Board of Studies for various universities in Delhi and NCR, as the Joint Secretary of the Delhi branch of the Indian Association of Physiotherapists. She continues to make more and more remarkable contributions to the field. Welcome, Dr. Seema Grover, to our Corporate Health series. Thank you so much for joining us.
Namaste. And thank you, Dr. Shriti, for such a wonderful introduction. But yes, of course, we all very well know low back pain, per se, a broader term back pain, is nowadays getting very, very common. And it is one of the major global health issues. Taking into account the quality of life of people, of course, absenteeism or affecting the work of people, and as one's man hours are lost, it affects the economy per se at large. So it is a global economic burden.
Yes.
And recently found, or in various researches, it has been stated that around 60% of the population, or working population, it is kind of an occupational hazard for them, which are aging from 30 to 60 years. And not only back pain, it leads to a cascade of concerns. So in between a term came sitting is new smoking. We all very well know the hazardous effect of smoking, but sitting per se also adds to a lot of our generic problems, or per se the non-communicable diseases. We all very well know by now we are diabetic capital. We have many people with hypertension, and pertaining to that, lot of neurological concerns or sudden cardiovascular accidents, what we call in our language. So if a person sits for more than 8 hours, it almost increases 125% the risk of cardiovascular diseases. Imagine how it is like an endemic, right? So it is very, very important that we all should understand. These days, our lifestyles call for longer sitting hours, be it traveling to the work, be it at work, coming back home. And with so much of media, of course, we really want to unwind. So it is almost 8 plus hours or 9 hours, we all are sitting unsaid. There are occupational hazards like prolonged standing also in certain professions. So these sitting and standing for longer hours is one of the major causes to have this kind of back pain, which is so prevalent amongst the workers these days. More so in corporate offices, meetings last for long, people cannot get those breaks. So it's one of the major things where we need to address it. And I'm really thankful that through this forum, you are putting it across to many, many people, which this is a major concern, which we sometimes take very lightly. But if people are aware, at least they can look after themselves.
So, in your experience, what are the main causes of back pain apart from the prolonged sitting and other factors that you mentioned?
One is awkward postures. Sitting is one part of it. But if I'm sitting in front of a desktop or having my laptop, then sitting in an awkward posture, the way if I am putting my elbows on the desktop and I'm leaning forward, so my body weight is not on my buttocks per se. It is either on my hands, or if I'm reclining back, it's on my back. So these awkward postures, sometimes the repetitive tasks, somebody is doing some activity for prolonged time. That is also another thing. Along with that, people, there is difference in anatomy, men and women. So women have different anatomy. They are more vulnerable to these kind of problems. It's not only hormonal, it is how their body shape is, how they undergo pregnancy, the hormone release, and various other causes, like they are primary care givers of people. So for them, again, awkward postures, repeated actions, maybe less time for their own physical activity. So along with this, uh, as I said, repetitive postures, maybe sitting prolonged, maybe standing prolonged, and physical inactivity, sedentary lifestyle is one of the major causes which leads to back pain mainly.
So, what would you really suggest for our corporate workers who really do not have, they say they don't like, because of the strict timings, the traveling, the deadlines. So they may not have much time for extensive physical rehabilitation or exercises. So, what would be your solutions for people to develop a stronger back?
As I said, like this forum, which is putting it across to people, that is one. If people are aware about their own musculoskeletal system and what relation does it have with sedentary lifestyle, then maybe even being a little more physically active. Something like even the studies say if 3 hours or 3 kilometers, you walk twice a week, you may curtail the risk of cardiovascular diseases to a great extent. So if I'm aware that simple walking can help me, so that is what individual himself or herself can be more physically active. Taking short breaks in between, which came as a Pomodoro technique, that every 25 minutes, take a 5 minutes break. So it was something which was actually done for CEOs and all, that you keep doing work, but still there is a lot of work and you still feel it is so much still pending. And there is no thing that one would ask for sincerity, are you doing or not? Because you've reached that level because you're doing. So they said that if you take short breaks and try to finish the task in a smaller time, like 20 minutes, and wrap it up like that, and take short tasks and take little breaks. So it makes your brain even more active. Then you physically get up, go somewhere. So it helps your musculoskeletal system also to work better. That we all, well, I believe, feel it because it is one of 4 or 5 people, all of us, ever once in time definitely would have felt this back pain. So whenever there is a nagging discomfort, the mind is not 100% to the work. So it's equally important that if we take short breaks, if we move around in between, make ourselves more physically active, we can help us ourselves to have keep it at bay or can help reducing this discomfort.
Right. Also, would you like to tell us a little bit about what kind of ergonomic changes do people have to make at their desks, whether they're working from home or whether they're working at office?
These days, after COVID, I believe came the era of being hybrid. So our medical profession may not be hybrid, but
Yeah,
the
but
rest of the industry still is working hybrid, right? So during COVID and post COVID, I get a lot of teleconsultations, very young people asking for such concerns, backache, neck pain. And it is more so prevalent in them because they have long working hours and they do not have a proper workstation generally. So they take their laptop and sit. So what is more important? That a good ergonomic advice, which we generally do for our people here in the hospital, also a regular trainings to them, where it says that your eye height should be in an angle to screen. So you should not be looking up like this or looking too down like this. But when we are sitting with our laptop, generally we tend to look down because it is kept down, right? So that is one. So neck is bent forward. And generally it will incline quite a bit back to the seat. So again, I'm not loading my buttocks, but I'm straining my back. Next thing is that whenever I sit, my feet should be planted on the ground. It can be the ground, it can be footrest. Knees may be slightly higher or at the level of hip. Elbows should be at 90 degrees. So many times we cannot change the height of the table. Seat can be changed. At the same time, one can have a little footrest to have the feet well on the ground. So these are basic ergonomic changes, what one should do. And the screen should be right in front of the face, the way you are sitting, not at an angle, because then there'll be muscular imbalance and gradually it will be imbalance in the form of what we call as the way we talk of alignment. So biomechanics of the body is altered. By and by, if regularly we are attaining some specific posture most of the time of the day.
Also, we've heard about, the mobile phone usage also causing a lot of, not so much of back problems, but other aches and pains. So, are there any tips there as well? We might as well talk about that also when we're discussing our surroundings.
One of my favorite areas whenever I give ergonomic talks. We all hold mobile phone and the neck is almost at the angle of 60 degrees generally. And biomechanically, if I hold and look at something straight, I'm loading my skull weight to the spine, right? But as the angle increases, the muscles of neck, they have to load way more. So much so that if I say my skull weight goes around 5 to 7 kgs or 10 to 12 pounds, then it is around 60 pounds my muscles have to take that strain. So we can imagine, and if we watch our screen time, it's always quite a bit for most of us nowadays. So definitely the degeneration of the bones, the muscle malalignment sets in. And here are the cases where they can go on various musculoskeletal concerns much earlier in life than which was said earlier. So definitely keeping a better posture is advisable and it would be something like prevention is better.
Absolutely. Also, some office roles are not desk jobs. So they do, some workers do have to lift heavy weights and perform manual work. So we mustn't forget about them as well. So, what would your advice be for people who need to be doing a lot of lifting and pulling and pushing movements? Does it affect the back as well?
Definitely. What most important aspect is if my muscles, we humans are biped, body was to be like being on all fours. So once we humans became as standing humans, so the agonist and antagonist, there are two group of muscles. Maybe I can say, if I talk of abdominals and extensors at the back, so they have to be in a sync, or the core should be stabilized. What I wish to say. So if my core is stable, if my muscles are strong, then lifting heavy load may not strain my back. But because women being multiparous, women and men sitting for longer hours, the musculature becomes weak and we do not get enough time to even exercise. So that's the time when the back or the spine goes vulnerable while lifting or shifting heavy. So my advice to people would be that whenever, if you have to lift a heavy load, then bring it near to the body, bend on your knees or what we call as squat, then the load should be just next to the body and then come. So the strain at the back is minimal. But if somebody is just bending forward, keeping the legs straight and then pick up, then the chances of having the discal concerns is very high or a catch in the spine, the way people call a sprain can happen. So it's very, very important to be physically more active, keep your core more stable. That can only happen when one is regularly walking, doing certain exercises, and more so on the people who are sitting for longer hours.
So, when we talk about apart from the movement that people need to do and not sit for prolonged periods of time, what kind of exercises do you think people should do? Because though people may not have time today, the availability of gyms and a variety, many times gyms in the workplace as well. So there are core strengthening, Pilates, there is yoga, there is strength training itself, and then there is, of course, the cardio aspects. So many varieties, plus aqua. related water aerobics, and then there is swimming, of course, walking, running. So I think people are quite into, I mean, there is definitely an increased interest in a variety of exercises these days. Whether people are consistent or not is a different matter. So, what would you suggest that a bare minimum that somebody can actually do to maintain good physical fitness so that they don't get affected by all these problems?
See, we need to understand first, prolonged sitting or prolonged standing can give us some vascular concerns, right? Calf cramps, calf pains. Second can be some muscular weakness or being belly little bigger, maybe abdominals little weaker. So very simple thing, even if one is sitting, one is getting out of the seat every 20, 25 minutes rather than calling somebody, maybe just go to the desk and come back, having frequent water breaks because hydration is equally important for the body. Certain exercises like doing ankle pumps means just moving your ankles up and down in sitting itself is like aiding to the circulation. Then, very simple, even if you are on your desk, just sit to stand. We all can do that. It is very much available. So, every hour, if we can do 10 to sit to stand, so at least something like 10 kilocalories we are burning. So it is so beautiful. If in a day of 8 hours, if I just do sit from my seat, I mean, just stand up and sit back again, is a simple one. Doing certain stretches, like just even stretching your body back with your hands behind. So you're stretching the whole anterior fascia, which over the time when one is leaning is gone a little tight. Just turning and touching your chair on either side is spinal mobility. So these are very, very simple ways in which I can keep my body more flexible, have a better circulation. And for the strength, just even lifting little stuff in the hands, wrist is arm strengthening, sitting to standing is your leg strengthening. So one has to go nowhere, but one has to be consistent is important, I believe.
Do you think that the body weight plays some role in the development of back pain?
Definitely. Generally, people who are obese, they are found to be less physically active. That is one. Second, maybe there can be various other factors for their increased weight. But we all very well know if one has a sedentary lifestyle, weighs little more, is less active, is more prone to osteopenia, osteoporosis with advancing age. Because if anybody with age, if somebody is going to go or with the hormonal changes towards osteopenia, we ask them for a lot of physical activity, more of strengthening activity to bring the bone strength back. But if the strength is lesser, bone strength is lesser, then the chances of having various other concerns also add on. And again, less muscle mass. So, physical activity, if it is there, ideally obesity or increased weight would be much lesser. And the chances of having these problems like back pain, other concerns coming goes much lesser. So obesity or the weight gain definitely plays a role in low back pain. It will be better bone strength if one is maintaining an adequate weight, better muscle strength if one is maintaining a better weight. So it is important that one should keep the BMI in watch.
Also, stress. So there is a theory that stress causes people to tense up their muscles, and then this manifests itself as headaches and backaches and so on. So is this theory correct?
Yes, stress has a significant impact. We all know, along with the stress coexists anxiety, depression. Generally, we see people who are in stress, they'll be more anxious or depressed or with other certain emotional issues. So, the coping mechanism for the pain also reduces in these people. It is affected. And more so, whenever we have stress, we generally take to alternative unhealthy coping mechanisms. like smoking, drinking, overeating. So, not directly, but indirectly, all these also affect adding to the back pain or neck or back pain, one can say, the postural pains with prolonged sitting in the employees.
What do you think corporates and companies and workplaces can do to foster better back health and better physical fitness in their employees?
First of all, I would like to honestly thank our chairman that we have Apollo Health Check, which is an annual check venture for all of us. So it with age, with the kind of work, it once a year one gets that done. So any and every corporate should definitely put that as a thing that their employees should undergo a regular health check. That is one, because when you get your investigations done, so many times women, we all are working in closed doors. So we find vitamin D3 is less. We find that their bone health is not that good. And sometimes it just comes up like that, that one is having osteopenia, a woman aging, nearly menopausal, having osteopenia, but doesn't understand and just complains of mild back pain. So if he's getting investigated, and during the investigation, if she gets to know she has osteopenia, so the line of treatment for the back pain is a little different. She is supplemented along, and at the same time, she does physiotherapy and she improves to good. So I believe that is one of the things, having annual health check would be one big thing. And second thing, like what we do here is what we follow in New Delhi. I give regular ergonomic sessions to various departments of the hospital because their needs at times are different. People who are into, I say, accounts or admin areas, they have different requirements. Our medical health professionals, like nurses, like surgeons, they have different kind of ergonomic concerns because nurses may be standing for quite some time. So sometimes their circulatory concerns are there, and their bending or lifting patients or transferring them can give them back pain. So advising certain postural corrections, certain exercises which they can do to unwind, and how they can stabilize their core is one thing. People who are prolonged sitting, for them, giving them certain advices, maybe wearing a compression, maybe how to use their mouse pad while they are doing work on their computer, and how they should be adjusting their workstation. So these ergonomic advices, if are regularly, repeatedly given to them, they definitely work on it, and very much they are aware of their pains. So before it turns to chronic, they can come and take advice and can really get better rather than being absent and not really able to cope up.
So, what happens if somebody actually develops like a kind of a chronic back pain? What kind of medical advice should they take? When should they see the doctor?
See, certain pains, like if a pain is generally, like what kind of population at workplace, when I see, if a person is complaining of pain which increases at night, then definitely one of the reasons it should be, or is along with fever and chills, back pain, or the pain worsens with rest, not only night, but worsens with rest, definitely should be the time. Or if they are having something like suddenly person feels that there is some weakness along with the back pain, or there is something like numbness, pins and needles, and I'm unable to really walk comfortable. Or in worse scenarios, if somebody had certain concern and is unable to have now bladder bowel or fecal or urination control. So those would be the times that they should definitely have a physician or an orthopedic or a medical consult positively. I mean, those would be the kind of red flags that where they should immediately rush to the doctor, and they should be knowing that it cannot be ignored, because the common concept remains that it'll get better. and you are trying to do it, but rather than getting better, now if one has a resting pain, one is losing weight. So many times we think that maybe I'm not eating enough, but that's the time definitely a medical consult is necessary.
Right. And what are the ways in which back pain is treated?
Okay, so as a physiotherapist, I would definitely like to say that initial acute discomforts should be definitely the employees should think that they should meet a physiotherapist, because there we do clinical assessment, which is basically mechanical kind of MDT or mechanical diagnosis and therapeutic or the treatment. So where with various outcome measures or patient reported outcomes, I would say that we have certain questionnaires where we assess the patient and put them into categories like with moderate pain or with low risk or with high risk. So accordingly, we tell them that what exactly is required is just a ergonomic advice, okay, or the person would require some physiotherapeutic measures or regular exercises, or maybe some multimodal treatment, one can say, that may require some NSA for some time, and along with that, going for therapy or working only on physiotherapy, exercises, and modalities, one can improve. So, definitely, exercise or to begin with, physical activity has a big role. So, knowing the symptoms, they should definitely go to their physiotherapist and then really understand that what exactly is the diagnosis and accordingly get treated would be the thing. Generally, they are supplemented with a home plan, so which they can manage at home. And if required, then it is the care provided.
Is there anything else that you would like to say to our viewers about back pain?
Very much that regular exercises can definitely keep all of us at bay. Our spine is a very mobile segment. If we keep the musculature around in its good tone and its strength, there is no way that one may develop pain. If the pain is because of any other medical concern, definitely, I have already spoken that they can go back to the medical consulting and can get it treated. There is treatment. But thinking that my pain may go on its own, it's just like that, I should not remain sleeping over it, maybe is the term I would say, that one should not remain with those myths that nothing will happen, I'm going to be fine, it'll get better. If a pain which is initially acute and gradually goes chronic, definitely one needs a consult, because if I am healthy, if my back is healthy, if per se my system is healthy, I'm able to perform better. And this adds to one's self esteem also. I may be a more satisfied employee. I would work better. And emotionally also, if we all are told that you are really good, we feel better. So it is very, very important that if in case there is any kind of concern related to back or any musculoskeletal area, it should be definitely addressed immediately. Right.
So, thank you so much, Doctor, for this very illuminating session. Dear viewers, I hope that you found this session useful. And the key takeaway was that there are ways to avoid work related back pain. As an employee, you can lead the team effort. You can make up strategies that protect your back. Your employer can provide support too by using good ergonomics, making workspaces and tasks comfortable for you and safe. So be aware and take care. Till I see you next time. Thank you and namaste.